As we go along, if you would like to tweet about our webinar, the hashtag is SCI Webinar. And all of the slides that we're going to be presenting today will be available on SlideShare following this presentation. For your reference, Supply Chain Insights is an analyst firm that is focused on delivering independent, actionable, and objective advice for supply chain leaders. We basically fund supply chain research to allow leaders to understand which processes, which technologies are the most important to drive supply chain excellence. It is that goal that has really driven us to fund this work on Supply Chain Index, which is a way of measuring supply chain excellence. Today I'm joined by Abby Mayer, my research associate. She's sitting in Chicago today. Abby, how are you doing this morning? Welcome. And George Runger, who is with Arizona State University, leads the operations research team there. George, good morning.
Thank you, Laura. Good to be here.
Yeah, thank you. And I've loved working with you and your team on this research. It's been great. So let's get into it. So our vision was to really nail down our concepts of the supply chain as a complex system with complex processes with increasing complexity. Abby and I had done some work on really understanding supply chain ratios, and we wanted to understand who was doing supply chain best. And we knew that we couldn't throw all industries into a spreadsheet and shake them up. Instead, we needed to look at the supply chain as a complex system. It was our belief that the ideal supply chain would be resilient and predictable, it would be balanced across a set of metrics, and it would show year-over-year improvement. And we built our first model, and it looked like this, and we believed that companies needed to maximize profitable growth, trade off revenue and cost of goods sold, be able to balance working capital with increasing corporate social responsibility goals, and then be able to align asset strategies. While many companies were focused on forecast accuracy, customer service, and inventory, we couldn't find good sources of consistent and accurate data for forecast accuracy, case fill rate, and corporate social responsibility. So instead, we built this second model, which we call the effective frontier, which says that companies are trying to balance growth, profitability, cycles, and complexity. And what we found was that 9 out of 10 companies were stuck at the intersection of profitability and cycles. And one of the things that really bothered me when I wrote the book Bricks Matter was I thought after 30 years of supply chain progress, I would be able to write a celebratory book about how companies had reduced costs and improved inventory turns, and I didn't see it in the data. So I asked Abby, and poor Abby's been working on chart after chart for me to really help me with, if we took the last decade where we've spent 1.7% of revenue, how have we done across the industries? And so as we look at the industries in the healthcare area of pharmaceutical, medical device, and hospitals, you can see that the pharmaceutical and medical device companies operate with some of the highest margins of any other industry that we study. They also have some of the lowest inventory turns, and they have improved revenue per employee over the period of time, but not to the degree of some of the other manufacturing companies. Now, in the case of pharmaceutical, over this period of time, we actually saw an improvement in operating margin, but we saw that medical device companies actually lost margin, but we didn't move the needle much on inventory, despite lots of projects to reduce inventory. Now, when we contrast that to the hospitals actually increased inventory, but what happened was many hospitals engaged in vendor-managed inventory programs that pushed inventory back on the supply chain, especially in the medical device area, without really improving the total inventory or the total resiliency of the industry as a whole. So we found this very interesting, and if we look at the progress over the last 12 years, here's the healthcare industry in a snapshot, starting with the hospital channel where, we actually are seeing margins going down as we look at affordable healthcare. we have inventory turns that, are going up, and the cash-to-cash cycle is, decreasing, and that was all well and good. But the overall health of this industry is one that I worry about because we are shifting inventory without really improving value. And both medical device and pharmaceutical companies are struggling to hang on to their margins. Even if you look at pharmaceutical companies over the 12-year period, it looks pretty rosy. But over the 2009 to 2012 period, with a lot of drugs on the patent cliff, that becomes a much different story. So what Abby and I wanted to do was we wanted to understand what drove supply chain excellence. And so we looked at how many companies were able to make progress at the intersection of operating margin and inventory turns, because that was to be the promise of all this technology we were going to get, right? We've all seen the signs in the airport. We've all seen the decks. And we were all going to purchase advanced planning and ERP, and we were going to be able to drive wonderful things at the intersection of operating margin and inventory turns. But what Abby and I see is that most of the time companies are able to make progress on 1 year or 2 years, and maybe it's a project basis, but they're not able to make progress for 3 and 4 years, and we see this consistently across the industry. Now, companies get more serious with a recession, but because they've not built the potential of the supply chain for either building global operations or being able to deal with demand, we find that companies can't persevere because they haven't built the potential. And in fact, in our research, when we ask companies to describe today's supply chain, 1 out of 2 companies say there's a lot of room for improvement. It's cautious, it's reactive. And we find this in spades in the healthcare industry, and particularly in this slide around risk with rising demand volatility and issues around multi-operations complexity in the global world. The healthcare value chain is starting to get more and more serious about supply chain. So Abby, let's talk a little bit about our work. How did we begin this work? Tell the group what you were up to over the last 2 years.
We started in February of 2012, and at that point I was manually collecting financial data from 10-Ks and annual reports through investor relations websites, and eventually that evolved to the table you see in front of you now, which is a list of about 50 financial metrics, and we've sorted those to correspond with the effective frontier model in terms of growth, profitability cycle, and complexity ratios.
This was hard work, wasn't it, Abby? And then, this work we did on correlations to market capitalization. Talk a little bit about this.
Sure. Last year we did some pretty extensive work trying to connect the specific supply chain ratios you'll see on that left-hand corner of your screen with market capitalization. And what we were able to find is that some ratios correlated for some industries and didn't for others. It was very specific to the industry. And it was also, it was hard work, and there's a lot of other things that go on within market capitalization that are so separate from supply chain. We changed our focus a little bit when we got back to work this year on developing the index.
Well, and we were using R at that point in time, and I think we found out we needed to have greater math capabilities, which is why we reached out to Arizona State University. We weren't able to build linear models, but we were able to see with the 6 years of market capitalization that inventory matters to market capitalization and that operating margin mattered. And so that started us on our journey with Arizona State University. And we interview supply chain leaders as we go along, and one of the quotes that I love is, I hear this in spades from others, is no significant supply chain improvement happens in less than 3 years. We may see small changes, but we were really looking at how can we drive substantial progress. So, Abby, we came into then doing about, 1,000 orbit charts to understand where we're making progress. Tell the group what an orbit chart is.
Yep, so this is looking at 2 different financial metrics. You'll see inventory turns on the y-axis, operating margin on the x-axis. And you can trace the pattern of the performance in this chart. It's Walmart from 2000 all the way to 2013. You can see, you know, they initially started in the early years losing operating margin, and then they sort of recovered and they did a big loop closer to more recent times. The other thing to notice is there's a big diamond right in the middle, and that's the average over the whole period. So for this time period, Walmart has an average operating margin of 0.06, and 7.8 is the inventory turn average over that whole time period from 2000 all the way to 2013.
So Abby, when we first started doing orbit charts, and we've done so many, I had expected, based upon my years as an industry analyst, to see charts that would take us to the best scenario, almost a linear progression. In other words, we got the process together and we got the technologies together and we put our muscle to it and we would drive supply chain improvement. But I've only seen that in one or two charts. I've been surprised how many twists and turns we have at these intersections. How about yourself?
Yeah, I would agree. I think, you know, revenue per employee is an example of a metric that sometimes shows a little bit more linear progress, but generally it's been a rough journey.
It's been a rough journey, and we find that more circular movement than I think that many companies understand that they have. So we built the orbit charts, and it was about that time that we published all the metrics that matter reports, which are on SlideShare, where we analyzed each of the industries, and that gave us a background to really start to engage with Dr. Runger. So Dr. Runger, I know that I met you at the Infor conference, and we talked about resiliency. What are your thoughts about working with us and developing the resiliency methodology?
Yeah, it was interesting. There's, as you mentioned, there's a lot of differences between industries and even differences between companies that are substantial. So it was sort of, you know, how do we put some numbers to this to describe the compactness of those orbit plots as sort of a measure of that resiliency or stability of the organization. And we looked at a few alternatives for trying to measure that. We finally settled on a fairly simple approach where we look at the pairwise distances between all of the points as a measure of compactness. That type of measure is used in other places, such as clustering analyses, and so it sort of makes sense. It was a simple metric, and it seemed to capture what visually we see in those graphs.
Yeah, you know, Dr. Runger, I've got Abbott Labs and Shire here, right? And Abbott Labs actually performs better on our index than Shire, and, you know, Abbott is much more resilient than Shire. I think it just goes to show just how many swings some of these patterns have. Here's Boston Scientific versus Stryker, and the fact that supply chains just aren't in very good control. And so as we look at the mean distance of the points here, you know, we were able to determine that medical device companies were resilient. However, we're going to see that they're not very strong. Consumer packaged goods companies were resilient, but pharma was less so. And then when we get down to contract manufacturing and third-party logistics, we find that those swings are pretty wild. And I know, Dr. Runger, you'd looked at a couple of different alternatives to look at, you know, the compactness. Can you talk a little bit about that?
We had explored methods related to principal component analysis, which is fairly commonly used to try and characterize the variation in a set of data points, particularly when you have multiple variables or measurements that you're investigating. Like here, there's both operating margin and inventory turns, and we might have other measures included in a particular analysis as well. But the principal components analysis, although it works well in a lot of cases, it just didn't seem to capture that compactness measure as well as these distances between points that we preferred. We looked at a few other alternatives related to distance between points, but but simply looking at sort of the average distance or the median distance between the points seemed to work pretty well.
Well, thank you very much. And then that carried into the supply chain index. And what we wanted was a way to say, are companies making improvement? So the supply chain index is a measurement of improvement. It doesn't really put a stamp on a company to say, you're the best. It just talks about relative improvement. And so what we wanted to do was to look at the pattern at the intersection of return on invested capital. And if you remember, return on invested capital had a high correlation to market capitalization and growth, because we believe the supply chain should power growth. And then we also wanted to look at strength. So what was the pattern at the intersection of inventory turns and operating margin? And then resiliency, as Dr. Runger has explained, which is a measurement of the compactness of the pattern. So we decided that we would look at the companies by industry or by NAICS codes, because we don't think it's effective to put all companies in a spreadsheet and shake them up. And it gets to be pretty complex, and we wanted to understand how are the industries doing and how are the value chains progressing. So in this framework, what we do is we calculate first a balance factor, which is the proportional difference at the intersection of return on invested capital and also growth, and that gives us a balance factor. And then we calculate a strength factor, which is the proportional difference of the points on the orbit chart for the period at the intersection of operating margin and inventory turns, which gives us a strength factor. And then we calculate the resiliency factor, which is the mean distance of the points at the intersection of operating margin and inventory turns. And then we rank them. So, Abby, what have you found in doing this work?
Yeah, I think there's many things, but one of them would be, rarely does a company come in ranked #1 across all three categories, balance, strength, and resiliency. There's a lot more nuance and complexity, and so trying to balance those priorities.
Right. And, we've talked a lot about balanced scorecards. I love Kaplan's books on that. But I don't think we've really looked at, just what do the patterns look like and what does balance mean. And I think we have a false assumption that we're making far more progress on supply chain on the strength factor than we are, and I think resiliency is new. So the final index that we will roll out at our conference in September weights these factors at a percentage. So if you go back and you calculate the factors and then you weight them, currently the work that we're going to show you gives a ranking of 30% balance, 30% strength, 30% resiliency, and we will ask peers or people in our Shaman Circle network to rank the companies also, and that will be a 10% ranking. Now, we are talking to supply chain leaders about, do we have these relative weightings right, and do we have the time period right? And I want to sensitize you to this as we go along. If we do, I want to just gain perspective, As we look at the race for supply chain excellence, I think we've got to think about what is improvement. Because a small improvement for a world athlete like Usain Bolt is a wonderful achievement, right? But if I go run a race, I can have a big improvement, but I'm not a world-class athlete. So many of the companies that are the best in supply chain are making very small improvements. So this is a methodology that looks at improvement, not necessarily the company that's doing it the best. It's sort of like The Biggest Loser. The guy that's the largest guy on the show will often lose weight the fastest. But what we wanted to do was to get perspective and to give supply chain leaders a methodology to measure, are they making improvement? So if we look at the value network and we map the parties in the value network for inventory turns and operating margin, we have a hospital provider, as shown here in red. We have Abbott, shown here in purple, and we have Medtronic at the bottom in blue. And that gives you kind of a perspective of how companies are operating. You can see here that you know, the hospital that we selected is actually making improvement in operating margin, but not in inventory turns. And that Abbott is going backwards in margin, as is Medtronic. And we see this a lot in the companies that we're going to show. Now, when we look at the progress of the industries in the healthcare industry versus consumer packaged goods in the retail industry, and you look at the difference at the bottom, the balance factor, the larger it is, the better we're doing. The strength factor, the larger it is, the better we're doing. The resiliency factor, the smaller it is, the better we're doing. So you can see that the consumer packaged goods industry has better rankings for balance, stronger rankings for strength, and better rankings for resiliency. Of all the industries, they're making the best progress. And then we get into the hospital industry, and you can see that there's a lack of resiliency. It's a very large factor compared to other industries. They are making progress primarily on strength due to inventory shifting, but not necessarily improving their own processes. But on balance, which is really dealing with growth and return on invested capital, they're struggling. And a lot of that's due to the Affordable Health Care Act, the restructuring of hospitals, and the fact that they're very fragmented. Now, the pharmaceutical companies in this period of 2006 to 2012 are making progress on balance, so the intersection of growth and return on invested capital. They are making progress on strength, and they're also doing pretty well on resiliency. However, you will see in the period of 2009 to 2012, they aren't able to sustain that due to what's happening with drug regulation and the drugs coming off patent. The medical device industry is not able to achieve the same balance. They're actually going backwards in strength, and they do have a fairly tight pattern. So let's look at the actual industry. So we start with saying, where are the companies if we just plotted them, and this is inventory turns versus operating margin, just to give you an idea of where we see the hospital industry, pretty fragmented, not a pattern. And then when we look at the supply chain index for hospitals, you can see that HCA Holdings actually ranks at the top here, but not a lot of real insights here because I think we have such a random pattern. Abby, any thoughts here?
Yeah, I think you'd mentioned this earlier, but what I see especially for the hospitals is that struggle to get those resiliency numbers low. So you have very high numbers. Tenet comes in at a resiliency value of over 5, which is high for this industry, but also incredibly high compared to other companies in other industries.
Yeah, in fact, it's one of the highest I've seen. And, we don't see it really getting better when we look at 2009 to 2012 or a more recent pattern. Any thoughts here?
Yeah, I think sometimes when you look at these different time periods, the rankings can shift a lot, and sometimes they can stay pretty static. But it's important to know what is the first year because that's the baseline that we're measuring any improvement off of. So
don't really see a lot of change here, but we do see still a struggle with resiliency. Now let's look at the pharmaceutical industry. Abby, walk us through this chart.
Sure. So this is similar to the orbit chart I explained earlier, a little bit different. We still have the inventory turns and operating margin metrics. But what we're looking at here, each line fragment is a different company, and I've identified a couple of the companies. Each company has 3 points, and so you'll see identified the performance in 2006, 2009, and 2012, just to get a sense of where their performance was trending.
And the reason why we didn't show all the points of the orbit charts is just because we've got an issue with, we'd have too much noise in the numbers. And what we're really looking at is, how many companies do we see are, making linear progress? So Abby, who are your thoughts about who's doing this the best?
Yeah, so I think when you get to the pharmaceutical industry, as we'll see on the next page, some of the companies that are coming in high on the index rankings is Novo Nordisk and Biogen. And so those patterns to me are a little more linear. There's less sort of looping back going on with those two companies in particular.
Which I think really gets to reliability. You know, when I review this data with Biogen, they kind of hang their head and say, well, they're not doing as well, but they're making improvement, right? We're seeing more of a linear relationship on their improvement than we're seeing in some companies. So let's talk about the pharmaceutical index. Abby, take us through this.
So here we have the companies within the pharmaceutical industry. This is the larger time period, so starting in 2006 and going all the way through 2012. And you'll see, like I mentioned, Biogen comes in at #1, meaning not that they're the best, but that they have improved the most over that time period.
And then Novo Nordisk comes in as #2, and what I find interesting is the consistency of those rankings. We don't have anyone that's like a 1 or a 12. It's like they're hitting all of those cylinders together, which, you know, when we look at 2009 to 2012, we see them continue to make progress. So tell me a little bit about the differences in the time period, Abby, and what you see here.
Sure. So the longer time period starting in 2006, you know, just looking back, there's a lot more that went on in those 7 years, the boom and the bust. And so we started initially with that longer time period, and we've added on this new time period to look at just from 2009 onwards. And a lot of times industries will show very different patterns across these two different time periods. Specifically, the chemical industry comes to mind as one that just had a totally different experience if you include or exclude those earlier 2006 years.
But here we see that Novo Nordisk and Biogen are continuing to make progress, and companies like J&J or Merck or Bristol Myers that companies might think of as supply chain leaders are actually at the bottom here. And Abby, is it because of what we see and, you know, what the patterns that you've got here?
I think there's a lot of, there's a lot more research to be done on this, but obviously it always is surprising to see those well-known companies fall lower on the rankings than you might expect.
Yeah. So let's go to medical device. So we've got a very different pattern here for medical device, and we're working on building this out for the report that we've got. But what do we have here for the medical device companies? What do we see in the grouping, Abby?
Yeah, so here, again, there's about 15 companies. Instead of looking across 3 different years, 2006, 2009, and 2012, this is just based on 2012. And so what I notice is that most companies are in that bottom right-hand corner, so they have pretty low inventory turns and pretty low margin as well, right around 0.20. There's a huge cluster of companies that had a similar experience in 2012.
And we're not making much progress. You know, again, they're very resilient, but they're not very strong. And so when we look at medical device companies, what do you see here, Abby?
Yeah, when I look at the medical device rankings on the index, if you look at the column, looks like second to the right, where it says index 0.3, balance, 30% strength, 30% resiliency. Baxter comes in at #1 with a score of 4.2, and that 4.2 value is much higher than the #1 company in pharmaceutical or the #1 company in hospitals. And so you'll see it's not straight across the board that any of these medical device companies have figured out how to be balanced, strong, and resilient at the same time. There's a lot more variation in those rankings.
Yeah, which is a real representation of the lack of supply chain maturity, because we see like in CPG where companies are doing well in balance, or also doing well in strength, and also have that tight resiliency pattern. So these guys may have a tight pattern, but it doesn't look like they're able to make a lot of progress here on strength. They're really stuck on that inventory turns, and operating margins are going down, and struggling on balance. Do we see much difference in the shorter time period, Abby?
Yeah, so there are a couple different companies that show up on top in 2009 perspective versus the 2006 perspective. So you'll see Stryker and Smith and Nephew are at the top for 2009. There's actually 4 companies that come in with a value of 4.5, which is a 4-way tie for first place, I guess you could say.
But look at those wild swings. I mean, there's no one that's scoring well across that scoreboard. If you look at Boston Scientific, we've got some issues with resiliency, and so, we still have a lot that's all over the board. So Abby, what is your high-level findings about the healthcare value network and what you've been able to see when you plot it versus other industries?
Yeah, I think we started off with this earlier in the hour, but I think that the healthcare industry in general has usually had high margins, and so there's been less of a need to focus on supply chain excellence. That's changing now, and so companies are having to get a little bit more serious about supply chain processes as a result.
And we don't find the maturity here in healthcare that we found in consumer packaged goods. And next week we'll be publishing our report where we'll be finalizing these findings. What can people expect in that report, Abby, that's going to publish on Tuesday?
The report next week will be looking at these same 3 industries, so we'll be looking a little bit of a deeper dive into hospitals, medical device, and pharmaceuticals, drawing upon both of those time periods, 6 to 12 and also 9 to 12, to understand how companies have done and also how the whole value network, how those 3 industries combine together really to form an ecosystem.
And I guess I still am surprised, because I've been in the industry a long time, that 9 out of 10 companies are stuck on the effective frontier. I just really thought we'd see a lot more linear progression, and that we would see a lot more improvement. And, we've spent 1.7% of revenue on technology, and we do see overall resiliency of supply chain improving, but not to the same degree in healthcare as we see in consumer packaged goods. And as we've outsourced the supply chain, the lack of resiliency in contract manufacturing and third-party logistics, I think, should be a risk concern for all. And we also see that large companies that were early adopters, like Intel, made great progress at the beginning of the decade, but their progress slowed. And, what we want to do with the supply chain index is to be able to give supply chain leaders a way to say, are they making improvement? How do they measure up? And so our progress is really to finish this series of reports. We published the Healthcare Value Network report in July, and in August we published the Industrial Value Network. And then we have our final analysis of all companies, which we'll reveal at our 2014 Global Summit, which will be held in Scottsdale, Arizona. And at the summit, it's not about us, it's about supply chain leaders. We will ask the top leaders in the index across the industries to talk from the heart about their index, because I don't think we have best practices. I think we have emerging practices, and we want to really share how we're doing. So unlike other conferences where we've got people that stand up and brag about their projects, what we're going to have is an honest discussion about how do we drive reliability, and then we're going to ask ourselves the question about, can we improve this through new forms of technology, or by value networks, or perhaps disruptive technologies like robotics or manless vehicles, or robotics in the warehouse, or 3D printing, or concurrent optimization, or cognitive learning and new forms of visualization and analytics. So we're going to be imagining the supply chain of the future at our global summit in September. It's 10th and 11th. It's in Scottsdale, Arizona, and we hope to see you there. A lot of the essence of the work that we're doing here will be captured in the Metrics That Matter book that's scheduled right now to publish in November. We just finished the manuscript, and we're very excited about that. And again, we want to encourage people to come to the summit on September 10th and 11th and to continue to listen to our webinar series. We do have public training that's available in August in Philadelphia, and we continue to publish podcasts with supply chain leaders. We just finished one with Rick Sather of Kimberly-Clark talking about metrics that matter and his results on the supply chain effective frontier. So we've been busy, and we hope that it helps you as supply chain leaders. Abby, anything you want to say before we end our webinar?
Yeah, you know, I think we had discussed earlier the rankings or the percentage of strength, balance, and resiliency that will go into the final index number, and I'd love to encourage more conversation on that in terms of, you know, do we have it right? Does each of those count for 30%? Is it more important to be strong than it is to be resilient? And people can email me directly if they, you know, if they have a perspective on that. I'd love to hear that and get that conversation going.
Okay. Yeah. So we have two questions. You know, is 2009 to 2012 a better perspective to draw the numbers? And right now I'm leaning to 2009 to 2012. Abby, how about yourself?
Yeah, I would agree. I think, you know, that allows a little bit of time. We can't get too short. You know, we can't just do 2011 to 2012, but I think 2009 to 2012, there's enough time for changes to be made without getting too noisy or too spread out.
And then do we have the right ranking? In other words, should balance be 30%, should strength be 30%, should resiliency be 30%, and peer ranking 10? What's your thoughts there, Abby?
Yeah, you know, I think I'm still, I don't yet have an answer for that. I think that resiliency is important, but in some ways a resilient company isn't making progress, they're just stuck, and so then are we rewarding companies for being static? So maybe resiliency needs to be a lower percentage, but like I said, I'm not sure, and I'd love to encourage discussion on that.
Yeah, so here's how to get a hold of us. You know, feel free to send me your comments at Lora Cecere at supplychaininsights.com, and it's Abby Mayer at supplychaininsights.com. You can also interact with us on our blogs. I write at Supply Chain Shaman. I also write for Forbes. We're available on Twitter, and you can find us on LinkedIn. We'd like to hear your voice. We want to get it right, and we thank you for joining us on our webinar today. Thanks very much. Thanks, Abby.
Thank you.